Okay, so this category, double eyelid surgery as it's referred to often by patients and surgeons all over the planet, is treated like the only topic in Asian eyelid surgery, and that's not true. Typically, double eyelid surgery is a situation where you're creating a crease that either doesn't exist at all or it's just not visible. It's going to be incision technique most of the time if you want it to be as precise as possible and have the best longevity or last the longest. That can have a lot of details that go into it. All of these surgeries have a lot of details that go into it. The very basic things to start with if you're a patient and you're talking to a surgeon about Asian eyelid surgery is, number one, you need to express to them exactly what your goals are. If you simply say, I want to have a double eyelid, or I want to be able to see my crease, there's a tendency for surgeons to just take that for granted and just say, okay, they just want their crease to be either visible or make it a bit bigger, something along those lines. And if you don't get into the details with your surgeon about having a parallel crease versus a tapered crease, whether or not you want more room for makeup or you possibly even want to wear less makeup in the future, you may find yourself in a situation where you have a double eyelid or a crease that's visible, but it is a shape, height, or some sort of orientation that you don't like. Maybe it's a bit too much or it's a bit too small. So you want to be very specific about what your goals are when you go in to talk to your surgeon. And now you also need to take into consideration your own anatomy. When you are looking at examples online of surgeries that you like or results that you like, try and find people that you think might have some anatomy or something about their appearance that is in common with you, or some similarities between you and these examples that you bring to your surgeons. You can't simply just bring a picture of the most attractive set of eyes that you think look the best that are on a face that have a completely different shape than yours and show it to your surgeon. Again, that can actually mislead your surgeon. So a lot of the good and bad that results from surgeries is in communication. So that's where you want to start first. You need to do your research, find the right surgeon, and communicate clearly to them what it is that you're looking for. And if you don't have the confidence that you've been heard and that the surgeon has a good plan for you, and if they cannot show you examples of surgeries that match your overall look or match your overall goals, you're probably not in the right place. So double eyelid surgery is typically going to be a younger patient, again, maybe 25 or younger, 30 or younger, sometimes quite a bit younger than that, and you're making a new crease for that patient. The time it takes to perform that surgery is usually maybe an hour, something like that, sometimes less, sometimes more, and your healing time is depending on your anatomy, your age, the quality of your tissue. Can be a few weeks, it can even be a few months in some cases. Now, one other detail to talk about when it comes to creating a more visible crease for a patient is, what is their anatomy like? What are the limits of what you can do for that person within the parameters of safety and good taste and even just, again, your goals? So for instance, if you have a patient who has very deep set eyes and they have a strong brow that hangs over their eyeball and they are requesting a big crease, well, there's a limit to how high you can make it. Now, you can make a crease that has depth to it. If you're a patient whose eyes are a little bit obscured because the brow bone hangs over and the eyes are deeper set, then you can make a crease that's got good definition. You can make a crease that's got good depth to it. But it doesn't mean that you're going to have a lot of room for eyeliner, makeup, things like that that are going to be very visible after your surgery. So that's something to be aware of when it comes to your surgical planning, what your desires are, and how they relate to your anatomy. Now, the opposite of that is somebody whose eyes are actually very prominent or maybe very far forward, and the brow bone itself is not very strong, or at least it's not hanging over the eyeball. The measurements for something like that, where someone has what we call a shallow orbit or the eyes further forward, the measurements for that usually are going to be more conservative than the person with the deeper set eyes because it takes less surgical work for the crease to show. Now, that patient can very easily have a crease that's visible because their anatomy is all out in front. So the adjustment of the height going up or down is pretty straightforward. Now, the thing that the person with a shallow globe or a shallow orbit or an eye that's very far forward, the thing that that person can't really have is a lot of depth. Those are some basic things to know. Keep in mind before you go in for your double eyelid surgery if you're a patient on the younger side.